We're on. All right, so let me introduce what we're doing today. So we are here for navigating setbacks, and I'm here with my friend, Dr. Johnny Nguyen, Doctor of Physical Therapy. And we are going to be talking about what it takes for us to heal effectively from injury, and from the standpoint of both a physical therapist and a holistic health practitioner. And Johnny has seen me through my injury last November when I essentially hyperextended my knee. So let us start and begin by having us introduce ourselves. So welcome, Johnny. You have the floor.
Hey, Val, thanks for having me. Once again, my name's Johnny Nguyen. I'm a doctor of physical therapy and co-founder of Motion Lab Physical Therapy and Performance, which offers premier cash services to help individuals explore movement and get back to their movement goals. This is done in person, virtually, or through prescriptive programming. As a PT, I have experience working with individuals rehabbing from a variety of conditions, ranging from like spinal cord and brain injuries at Rancho Los Amigos, the National Rehab Center, to working with competitive barbell, field sport, and combat athletes. My movement background covers b-boying or breaking, powerlifting, and tricking, which is sort of like a freestyle acrobatic martial arts.
All right, so let me introduce myself. So my name is Valerie Beck, and I am a certified Ayurvedic practitioner. And I've been dealing mostly with diet and lifestyle and mindset coaching. I've been a clinical practitioner and I've been seeing clients since 2020. And I started studying Ayurveda in 2018. I'm also a movement artist of over 3 decades at this rate. I've been dancing almost my entire life. And then within the past 10 years, I've also added martial arts and acrobatics to my skill set. So I have dealt with a lot of injuries myself, and I've also seen a lot of people as a massage therapist with their injuries. So let's get straight into our talk today. And I'll let Johnny start off by talking about the common fallouts of physical injuries and what that means.
All right, so for the purpose of today's conversation, let's just define what an injury is. So in my point of view, it's just a stressor on the body that you're not quite able to adapt to in the moment. This may or may not result in tissue injury. So after an injury, it's really important to identify what type of coping style you have. And with the clients I've worked with, they fall into one of two categories. They either avoid movement altogether, or two, continue to persist and push through pain and discomfort. Now, each of these will have a different cycle, but also similar effects on recovery down the line. With the movement avoider, they're just going to avoid movement, decondition, and detrain as a result. However, this is going to end up affecting sleep because quality sleep is earned through having enough movement and physical activity through the day. If the quality and amount of sleep isn't quite there, this is going to predispose you to further injury. There's a mountain of research out there saying that if an individual gets less than 7 hours of sleep, they're at a much higher risk for injury. Okay, so on the flip side, with the persistent movers, you're going to end up compensating with different areas, as well as possibly overworking your system. And when your body's super overworked and just overly sympathetic, it's really hard to get into that deep relaxation that's required for nice and deep sleep. Once again, that cycles over again. And as the quality and amount of sleep decreases, you're predisposing yourself to injury again. So my role as a healthcare practitioner is to help individuals navigate this cycle and just create a plan from being at their baseline or where they're at right now to scaling up to their performance goals.
Awesome. So do you mind if I ask you a few questions and elaborate a little bit on what I've heard?
Yeah,
Okay.
absolutely.
Awesome. So what I'm hearing right now that I'm actually surprised to hear is that you seem to be putting a lot of emphasis on the importance of sleep, which I think a lot of people actually don't put two and two together when it comes to recovery and keeping your body healthy. So in your eyes, how important is sleep and what role does it play in, performance?
I think sleep is very important in the role of performance and recovery because that's the only time where your body really gets the chance to fully focus or work towards recovering and rebuilding. Um, Beyond that physical aspect, it's also when your brain's processing all of the events during waking hours, which plays a role in just like that visualization and mental performance with each physical skill that an individual wants to improve on or participate in.
Okay, great. And I will also add a little bit of perspective from the holistic side of things. As an Ayurvedic practitioner, we look at different mental and physical types or constitutions of people. And so there's three in Ayurveda speak. We call them Vata, Pitta, and Kapha. So without going too much into the detail of that, it's basically when it comes to physical performance, Kapha type, because they're a much more like um, heavy type of person and mentally maybe more stable, the tendency when they get stressed is to withdraw and stop moving and to lose motivation. And so that sounds like the type of person who would cope by avoiding movement altogether. Um, Whereas someone who is more willing to push through and bear the pain of it, we would usually refer to as a pitta type because they have more of that, I guess, fire element in them. But because of the fire element, they're also prone to inflammation and stuff. And when they continue, that can lead to fatigue and more inflammation and injury down the line. And then we have Vata types, which are a little that it might be a separate category in itself, but those types tend to get injured more often because there's also erratic ways of training because they're never consistent with the training. So people who train but kind of do it on and off and don't condition in between tend to be more prone to injury and are not quite able to keep up with the demands of the training. So I'm just adding a little bit of context there too. Just things to think about. Okay. Anything you want to add to that in terms of common fallouts?
Um, no, I think I'm good for now.
Awesome. So let's get into then my injury and recovery story. And I can tell it from my perspective, and Johnny, you can tell it from yours since you were there. So we both were in tricking class in November last year. And up until that point, I feel like I was doing pretty well. Like my flips were getting stronger and all of that. I think even like a few days beforehand, I was at another gym. I was like throwing side flips and all of that. And it felt great. So maybe I got a little cocky. But we were doing a move called side swipes where you have to essentially do a side flip where usually you can either land on the leg that the opposite leg of the one that you take off of, or you could land on both legs. Those are like the two most common ways to do it and the less impactful ways to do it. And then that day we were doing side swipes, which means that you land on the leg that you take off of. And it's a single leg landing. And so there's more momentum that goes into that and a lot more impact that happens on the leg. So what happened was that I took off, made it to the other side, but then as I made it to the other side, my knee dislocated and then hyperextended. So then I went down. And it's the first time I feel like I've had an injury where it's taken me more than a month to recover. Um, and really the first major injury I've had as an athlete. So, um, up until that point, I would say that, I've been very confident in my ability to recover and basically by myself too. Like I have dislocated an elbow, and that was attempting a back handspring on grass. Sorry, Johnny. And a bunch of other stuff. So, and it's crazy how quickly the elbow heals too. But I think with my mindset for recovery, even though I knew this was going to be longer, you told me at the time that it would take 5 months. And I allowed myself that grace of it taking 5 months. And in that time, I was like, I'm gonna recover. It's not gonna be a question. I'm gonna do everything that I can. So we did the PT once every few weeks. And then I did those exercises. And I also did everything in my power to support that recovery. So I changed my diet during those 5 months, especially in the beginning of the 5 months. And there were definitely points where I completely gave up wheat and sugar. Um, I took supplements and I did cold plunges very regularly. I'm still doing them. And I can't say, like, with the holistic approach to things, it's really hard to pinpoint what is helping, what's hurting. But the thing is, if you just create an environment of support like this, where you kind of build stuff on, it compounds and it just allows for the PT to be more effective. So, that's basically my story of like what has happened. And I'd love to hear a little bit about how you approached my recovery as well, Johnny.
Yeah, absolutely. During the day of the incident, you were doing really well with learning the trick. Um, Almost a little bit too well since you were getting a lot of momentum. And it seemed like you were straightening your leg fully before even landing,
Mm.
which is just going to predispose your leg to maybe straightening even more. Yeah, so we all heard you go down, and it's always scary when an incident happens. I think it was lucky that I was there and it was just being in the right place at the right time to just help stabilize your knee and give you that confidence to just kind of start moving, stabilizing your knee, getting back on your feet too. Oh, as long as we cleared that your knee was okay in the first place. Yeah,
Yeah,
like
what
we
did you
were
have to
totally
make
safe with that.
sure? What did you have to confirm?
There wasn't like any immediate swelling, and we didn't hear a audible pop or anything. Yeah, just looking at your knee, we just started with like some small movements, making sure that you can contract certain muscles in your leg, and then just kind of scaffolding yourself up to standing, weight shifting, and then just taking some baby steps with support too. Yeah, that was definitely an experience, especially since it's your first really major injury.
Mhm.
And then, yeah, we did start PT, and the first visit was more about education and setting expectations more than anything else. Because once you have a game plan, it's just so much easier to stick with it and sort of enjoy the journey as best as you can.
Oh, yeah.
Yeah, I think you did a good job of focusing on factors within your control: diet, sleep, stress levels, and just being really good with your exercise frequency. Yeah, it's definitely been a few months now, but I would say your progress has been night and day compared to the day of the incident.
Oh, yeah. I mean, the day of the incident, I remember we eventually got to my car and I drove home. And then from the parking lot, I had to find another person to help me up. And it took a while because it was literally just shuffling my leg. Um, to the elevator and then up to my apartment. Um, and I think it was another week. I actually like somehow made it without crutches for a week, which is crazy. Or no, like I made it without crutches for like a day or two. And then I got cocky. I actually tried, I did do a massage that week for a person. And it wasn't until on my way home, uh, I leaned and my knee gave and hyperextended again. And so, I've always been like, oh, I'm going to be okay. I'm going to be fine. So I think my type for the recovery type is usually the person who pushes through. And I think because in previous times I've been young, obviously younger, right? But not as major of an injury as well, where I got away with it. And that's the thing is like I think I see a lot of people who just get away with it.
Yeah, I'm definitely the same way. I think for a lot of us who are very passionate about our movement practices, there's just a tendency to be stubborn and push through discomfort. There's a huge culture of growing up and normalizing discomfort.
Hmm.
While pain is a natural aspect of life, you shouldn't be pushing past it all the time. And I think it's truly difficult to recognize when is a good time to pull back and when's a good time to continue pushing. And that's where it can be helpful to work with either a very experienced coach or a rehab practitioner to help you navigate that gray area.
Hmm. And in my own, because for the brief stint that I was a massage therapist, and I got to see people come in, and obviously, if people are coming in to get a massage, it's usually because they have some kind of pain. If they're coming to see me, um, and some of the things that I've observed in the clinic that when I was working for myself there is that the likelihood of somebody recovering has a lot to do with their mindset. And because mindset determines behavior, it determines choices. Choices down to like what time you get up in the morning to what time or like what you eat, all of that. And what you believe about yourself, even. And so I've seen like, people who come in with like major knee injuries have gotten multiple surgeries and are still very much struggling because they have no concept of like changing their diet. Whereas some people come in and they're injured because they don't know how to stop pushing through. And a lot of people, because I used to do Ashtanga yoga, and I think Ashtanga yoga is really intense, and people who gravitate towards that are people who are very harsh on themselves. And I've had a shoulder impingement because doing Ashtanga for a long time with that and continuously ignoring my shoulder injury. Um, so like even today, if I go a little too hard on yoga, just simply doing a downward dog, I will wake up with neck pain. So yeah, just seeing how people think and how they tend to ignore a lot of the signs is like really telling. So anyway, let's move on to your framework for rehab. So I really have appreciated your approach to my recovery because you seem to know where I want to go. And you have pretty good like idea of also pivoting and navigating, setbacks and stuff like that. So I want to hear what your process is when someone comes to you.
Yeah. So the first thing that I do when I'm face to face with my client is try to identify their goals as well as listen to their story and experience and kind of help validate that experience as well. Now, once we collect enough information and create some shared goals, that's where we can create a game plan to get you from baseline and scale things up in a progressive manner to reach your final destination, whatever that is. And in order to create a plan, we need to identify different qualities that are necessary to achieve such a movement goal. So we'll use like squatting 500 pounds, for example. If you're coming in for a hip or knee injury and it's your goal to squat 500 pounds, well, let's just make sure that one, you have enough flexibility to get into those positions and there's enough strength in the muscles of your hip, your knee, your ankle in order to support yourself for those tasks.
Mm-hmm.
Now, there's other factors such as endurance and technique, which I would look into as well. And those are all things that can be addressed during each session and different qualities, of course, to help scale someone from having trouble walking to getting back to performing at a high level. So once we have these qualities identified, it's just creating a plan of challenging but achievable progressions to allow the body to adapt over time. And once we have those expectations set, it's hopefully smooth sailing, but rehab isn't always linear and positive. You're going to have your peaks and valleys.
Mm-hmm.
So it's also important to be very adaptable and regress or lateralize certain activities so that your body's getting the right amount of stimulus to recover. Now, in addition to working on the physical aspect, the mental and physical readiness, its psychological readiness is also really important too.
Yeah.
At each stage, it's very important to build confidence for whatever task you have at hand. This can be done through focusing on mental cues to perform the task, or just visualization as a tool to just practice that task over and over again in your mind, which does have a good carry effect physically as well.
Can you give me an example of visualization?
Yeah. So let's use that squat for an example. So I'm going to define a squat as moving a weight, whether it's your body weight or a weight outside of your body, vertically up and down as your center of mass travels up and down. So some of the some of the mental cues that I like to use is to make sure that your foot is nice and stable and that you're able to push off your whole feet. Other people might need to work on keeping their rib cage and hips in a good position throughout the whole movement as well. And just using which muscles to really drive off them. Certain people are shifted too far forward and they'll have to shift their weight back in order to find that right balance. And other people have to do the opposite. So there's just a ton of mental cues that you can work on, and it's very individualized.
Okay.
In my case, it's putting enough pressure along that inner arch and really driving vertically as if you're trying to jump vertically to get the weight up. Other people might differ bit by bit based on their anatomy or mentality as well.
Mm-hmm. What does it mean to be mentally ready?
That's a good question. I think it's being confident in the work that you put in or preparation for a task and making sure that you're just checking off each step over time until it becomes second nature for the most part. Yeah, this varies with really every challenge that life throws your way.
Yeah.
Well, we won't necessarily be 100% ready. If you do prepare well, you can trust that your preparation will help you accomplish each task.
Yeah.
Yeah, how would you define mental readiness?
So mental readiness, for me, I think when I think about what like my clients and all of that, it's the willingness to shift behavior to progress towards their goal. Um, and that has to come from a mental decision. Because oftentimes, right, whenever people come to you or come to me, yes, they're coming for help for their problem, but they're coming to us for some type of motivation too. And because they know that what they're doing, they with just by themselves, they cannot accomplish where they want to get to by themselves. And so coming to any kind of professional usually requires them to change their behavior. And I think coming to us also kind of acknowledges that. But at the same time, we also need to prepare them and their expectations of what they need to do. So it's actually kind of a mutual, agreement where coming to us, they are giving us a little bit of permission to tell them this is what needs to change. And then from there, they need to agree to that, right? So that's, what comes to mind. Uh, and oftentimes there is a little bit of push and pull between client and practitioner. Just because sometimes they aren't mentally ready for what they're asking or what we're asking them to do, right? Like,
Oh yeah.
have you ever come across where you give somebody like a protocol, but there's something that's blocking them mentally from wanting to do certain things?
Yeah. That's where it's important to be really adaptable as a provider and just meet your client where they're at. The other day, I was helping a client who was relearning how to walk again, and she hadn't walked in maybe 5 or 6 months.
Hmm.
Um, it was our maybe third session together, and we got her to just slowly walk around the island of her kitchen. The next session, we did make it out into the hallway, and I asked if she was open to walking down a slope. And her words were, I don't know if I feel ready for that. And I said, well, let's just try like maybe 1 or 2 steps and kind of gauge how your body feels and just scaffolding her from there.
Hmm.
So I was by her side the whole time and she took those couple of steps, realized that her body was fully capable of doing it. So we kept on taking things one step at a time,
Yeah.
literally one step at a time to reinforce that confidence and ability to just achieve things.
Hmm.
And yeah, it was a really successful session. And I think a big part of being able to adapt to your client's readiness is also being consistent as well and creating a challenging yet safe environment for them to achieve their task.
Yeah. How much of what you do would you say relies on the client to work on their own? What, like in terms of the progress?
I would say 99% of it requires the client to put in their own work.
Yeah.
Um, just factoring in time. I'll work with my clients maybe 1 hour a week at most.
Yeah.
And there's so many other hours in the week where you can focus on improving your circumstances, whether it's performing the right amount of physical activity, my prescribed exercises, or just cultivating an environment for improving,
Hmm.
working on your stress levels, nutrition, sleep, and other factors as well.
Yeah.
So
So,
it really is a lifestyle change in order to really get back to achieving those goals.
so as someone who, because you're more like on the you're a doctor. So on your end of things, like you give the protocol and then the patient does the protocol. What do you think they can add in that doesn't require them to hire another person to like maybe just make sure that the work gets done to set in the structure for them to do it? Like what do you think helps?
Oh, that's a really good question. I would say that's very individualized as well. Um, like you said earlier, it really comes down to your mindset. You have to make that choice to put in the work in order to improve. And a lot of the times I'll ask my patients like what they think the consequence would be if they didn't perform X, Y, or Z, and just having them arrive at that decision themselves.
Hmm. Yeah. Yeah. So it's kind of just like seeing like what wouldn't happen if I didn't? Or
Yeah,
what?
so
Yeah.
it's just putting the ball in their court because at the end of the day, it's your body and you're the one who has control on what you're able to do.
Hmm. I think this leads into our next topic really well, and that because it has to do a lot with the mindset, right? And just the overarching mindset of our society in general. So we're going to talk about sick care versus health care and health span versus lifespan. And uh, Johnny, why don't you first give your perspective on what these terms mean?
Yeah, so sick care is something that's very reactive, and it's when you see a provider when you already have symptoms. So it's sort of like, oh, I'm coughing and I have a fever. I better go see my doctor right now. Whereas healthcare can include sick care. It also includes more of a preventative measure so that you're staying in a good position over time. So it's like going to your regular checkups and making sure that everything is well or identifying factors that could be problematic down the line. But since we caught things early, then it's easier to address now versus later. All right, so let's see. Next is health span versus lifespan. I'll define lifespan first, since it'll be a little bit easier to understand. So lifespan is the total amount of chronological time an individual has from conception till death. Health span is the amount of time that you spend living a high quality of life.
Mm.
So it's doing all the things that are meaningful to you. And these two things might not always coincide. Ideally, you want your health span and lifespan to be a 1-to-1 ratio. But for most of the population, that's not always the case.
Mm.
So I think statistically in the US, the lifespan's about high 70s, but the health span doesn't always coincide. Usually when people are in their 60s, they stop doing things that are meaningful to them. And a lot of these individuals do end up in nursing facilities or just don't live very active lifestyles anymore and stay in bed all day.
Mm.
So it's like their health span is that 60 years out of the high 70s of their lifespan.
Okay. Let me add a little bit more to this too. So the reason why I went into holistic healthcare, aside from wanting to explore better options for mental health support, I also believe that um, we're not just here to, eat, wake up, sleep, survive. We're given a lot of capacity to do a lot more as human beings, if we want to. There, as artists, as professionals and whatnot, like you can live a very joyful, full life. Um, and being sick really gets in the way of that. And unfortunately, we have you know, just the way that things have panned out in the States, especially, um, a lot of our lifestyle choices make us sick. And it does get in the way, right? And we see so many people these days struggling with stress, with chronic inflammation, diabetes. I mean, the most problematic diseases in the States are chronic inflammatory diseases, you know, heart disease, diabetes, obesity, etc. Um, and it has to do with, I mean, so many factors, right? Like our food system and our education and everything else that goes into it. So going into holistic healthcare, it's really let me see that, you know, our current medical system, a lot of it is geared towards sick care because one, we have a lot of people who are just sick. And so there's a lot of having to put out fires. And when we're only focused on putting out fires, we are less able to see what's beyond just that, right? So it's getting to that just barely surviving level, but not actually able to get people out of that to something, to a place where they can think more about their greater goals and their happiness, and et cetera, et cetera. So the health span and healthcare, you know, it's actually something I feel like we need more access to, and we need to also have more of our attention on it. And, you know, when I'm going to you for PT, it's not because I want the pain in my knee to go away, even like that's great. Like, but that's like the bare minimum. I want to be able to jump again. I want to be able to bend my, you know, like to squat completely and like lift weights and all of that stuff, dance, etc. that make me happy and make me feel like I am able to reach my goals and do the things that I want to do. Um, so from the standpoint of, you know, the physical therapy, then how does that how does that mindset influence your approach to physical therapy?
I would say, um, at the end of the day, it's really my goal to help improve the human experience of the person in front of me. And that entails being able to have enough capacity to participate in things that give them meaning. So let's say if you're injured and can't go out much, this is going to affect you on a social and emotional level as well. So it's really about identifying the factors that are the major roadblocks to what gives your life meaning. I think a lot of healthcare is very reactive, like you mentioned before. And that's because the system is designed or driven by profits rather than focusing on the person at hand. And this is just I would say this is just a huge societal issue in general.
Mhm.
And it's kind of unfair to kind of put the pressure on the individual due to such a societal issue as well. But going back to the question at hand, yeah, it's just doing everything in my power to identify the biggest factors to give you the most meaning in your life at the moment.
Yeah. Yeah, I agree with the not it's not fair, unfortunately. But America has put so much emphasis on this essentially the responsibility of the individual, right? Um, because we're very much that meritocracy as well. So like you have to be the one kind of mindset. Whereas, in other countries, it might be a lot more of a communal experience to heal and get better. Anyway, that's a whole nother topic.
Oh yeah.
Okay, so in terms of our questions that we have, or the what we want to cover, um, so I think it's really important. It's good for you as a practitioner to be able to ask people like what gives them joy and where do they want to get to. It's also important, I think, if anyone's listening to this, it's really important for you to think about yourself. Like, where is it that you want to get to? Like, what is your goal? Like for me, movement gives me the most joy. It's like my self-expression, and it's also a way for me to feel strong in my body. And without it, I do feel very, um, I can get really depressed. And even the small little things of like not being able to walk the way that I want can really get in the way of me wanting to do stuff. So, it's really important for me to think about like every day, like there's the greater goal of me being able to, let's say, like do a backflip again or whatever. And even if I never get there, it's just like there's that. And that's what I'm working towards too. And it motivates me every day. And then on top of the motivation, I think it's also important to, because unfortunately, it's really hard for us to do things if there's no structure. Like schedule in the times of the day that you're going to do your PT or whatever the self-care is by yourself, right? And put it on your calendar or something so that you make sure you do it, especially if you know that you're going to fall off of doing it. Um, okay. Anything else you wanted to say on this topic, Johnny?
I think you did a good job covering the topic.
Okay. Amazing. All right. So then finally, let's go into what to look for in a provider. So this can be any healthcare provider, but since we're talking about physical therapy, especially, this is actually something that I've been just super lucky because you were there on the day that I got injured, and so I already had the best PT for the job, right? But after I got injured, I've talked to a bunch of people, and they're all like, a lot of them asked me, what is your PT trying to get you to do? Because they do have this, awareness that a lot of physical therapists don't actually work towards getting somebody back to fully functional. And a lot of the time it is about the bare minimum of just like being able to walk again, which would have never been okay for me. Like I would want to do so much more. Like I was able to walk regularly within a couple of months, right?
Oh
So,
yeah.
yeah. So what to look for in a provider and to make sure that when you are looking for care, that you're going to get someone who really supports you.
Yeah, so I think the first thing that you should look for is someone who validates your experience. Just from personal experience, there are so many healthcare providers out there that'll tell you not to do XYZ tasks because it's just challenging or they can't relate to it. Although the said task at hand might be something that really gives you meaning and gives you that human experience. Yeah, so there's nothing worse in the world than feeling invalidated when you're already vulnerable and coming to another person to express that vulnerability and your experience with it as well. So in addition to validating the person at hand, you know that you're with a good provider when they're asking questions about your life and asking follow-up questions as well. Actually wanting to get to know the person in front of them rather than just treating them as, another number that walks through the door. Because that's also very common within our system. So in addition to validation and just being interested in the person at hand, a good provider will provide a very thorough screen, looking at factors, as many of the factors that can affect your current condition as possible. So in my case, in addition to looking at all of your physical capabilities, whether it's flexibility, strength, endurance, so on, I'm also asking about, life stressors, what your day-to-day looks like, sometimes about nutrition, as well as the amount of rest that you're giving yourself. So it's a very holistic view in helping someone recover. And then a good practitioner will have a plan or will be able to create a plan to help you get back to your goals or your specific needs. And this includes a step-by-step approach or something that's very comprehensive or systematic. And it also comes with frequent check-ins as well, because we can all use a little bit more accountability.
Mm-hmm. Okay. What are some red flags for things that would indicate that you might want to look for another practitioner?
Yeah. So as I touched upon before, not being able to validate your story or experience is likely the biggest red flag. And I would say number two, if someone stops or tells you to stop doing an activity, that's another red flag because it just shows that they don't have the skills to take you from where you are at now to where you're trying to get to. And then some other things are just listening to your gut. I think
Mm-hmm.
that's very important too, because your instincts will tell you or will be a really good indicator of whether or not you can trust or really work with someone. If the vibe is just not there, then that's also not the right fit for you.
Yeah. Yeah. Totally get that. Thank you. Okay. Um, as a provider, sometimes the frequent check-ins can be a little challenging, right? Especially if you have a huge caseload. So um, as a doctor, how do you make sure to keep on top of that?
Yeah, so I'm very fortunate in the way that I structure my practice, where I do provide the full hour with each client. And it's just me and the client during each session. So you're able to get that full attention. And because of that, the volume is on the lower side. So I do have more time to dedicate to checking in with my clients and making sure they're on track. And it's very client or individual dependent, but these check-ins can range from, just a simple text message or
Mm.
an email just to make sure that things are on track.
Yeah.
And I also have certain clients send me videos of their progress or themselves doing exercise to maintain that accountability as well.
Awesome.
So it's just allowing myself that opportunity and also being creative and adaptable with how you're checking in with your clients.
Thank you. Okay. Uh, awesome. So we're coming to the end of our talk. So the last thing that I'm going to go over is the holistic recovery toolbox. And these are the tools that I've used in addition to the PT in order for me to really create the right environment for me to get better. And then, Johnny, if you have any additional ones that you feel like also belong in there, feel free to chime in. So, I've definitely, as I mentioned, changed my nutrition. And the thing is, with nutrition, you have to be able to do this in a way that you know how to eat for the condition and you know how to eat for your body type. Because it actually is going to differ from person to person. And then I think also in um, the stage of injury that you're in, what you need to eat is going to differ. I mean, and it could be the same thing for other diseases as well. So it's always good to consult people who know if you aren't familiar with what you need. Another thing that I made sure that I did was just some kind of continued movement on top of the physical therapy, whether that just be like walking or doing just very basic movements or yoga in my own home. Um, the cold showers, cold plunging for me made a huge difference. And not only because it helps to reduce inflammation, but it also, for me, was a really good way to mentally reset. And it kept me positive during my recovery, which is something that was a really great added benefit because it's really easy to slip in sometimes to feeling bad for yourself when you're in pain. And another thing that I did was I did a lot of meditation. Um, and I just made sure that the amount of stuff that I was doing in a day was very reasonable for uh, not overloading myself as well. So the meditation helps because it, obviously it's good for mindfulness and to keep your nervous system at bay, but also um, at the same time, it actually just slows you down a little bit. So keeping the nervous system in parasympathetic and just keeping you relaxed and all of that. And it helps with sleep. So that's the last one too, is making sure that you do get enough sleep as you are recovering. Did I miss anything?
I feel like that's comprehensive. All of these things do tie in together. You need a lot of factors to just create that environment that cultivates healing. I don't remember if you touched upon just having enough like social and emotional support, but just
Yeah.
having uh loved ones or close people that you can lean back on or even spend quality time with is also very important to recovering and just helping that time become more enjoyable as well.
Yeah. Yeah, definitely. Because it's oftentimes when we get down on ourselves, it's because we honestly haven't reached out and we forget also that there are other people out there and also people maybe who are going through the same thing. So it might be good to just reach out to people who have gone through similar injuries and whatnot, because they can always provide a little bit of perspective. And that really helped for me because I got to talk to a lot of people who have torn, their ACLs. Not that I have, but like just the, people who have had to get knee injuries and just hearing about their perspectives and stuff like that has really helped.
Yeah, just having the experience of others is also very powerful. But also staying involved in your community is also a huge help as well. So let's say if you're a dancer, for example, and you're injured, well, just being around that dance practice and immersing yourself in that environment is also very constructive to your own progress.
Yeah. Yeah. Okay. All right. So that comes to the end of our talk. Thank you so much, Johnny, for coming on and sharing your expertise with us. So please let the audience know how we can reach you if we need your services.
Yeah, so I would say the best way to reach me is through Instagram at MotionLabPTP or email at motionlabptp@gmail.com. And I can't wait to hear back from everyone. Thanks for having me, Belle.
Yeah, thank you. And again, my name is Valerie Huang Beck. I am the leader of Club Phoenix and the founder of Intrepid Wellness. If you are looking for holistic life coaching and mindset coaching, I am here running my programs as well. You can find more information at www.intrepidwellness.life. Thank you so much for joining us, and we will see you soon.